Ramonie Smith with us. Hi, Ramonie. Hi. Hey, we had a miracle maker over there. And we also have grandmother Brenda with us. How are you doing, Grandma?
I'm doing great, thank you.
Cool. And what does she call you, grandmother?
She calls me Granny.
Granny?
I'm old-fashioned, but I wouldn't have it any other way.
You don't look like a granny at all.
Thank you.
Let's talk really quick, Granny. Let's have you go ahead and tell us about the why Ramonie is a Riley kid.
Well, Ramonie is now 8 years old, but Ramonie has been a Riley kid since she was 14 months old. She was diagnosed at age 20 months with an incurable kidney disease. We call it FSGS for short, which is focal segmental glomerulosclerosis syndrome, a disease that was actually taller than she was at the time they diagnosed her. This disease is an immune system disorder that can actually destroy kidney function if not put into remission, somewhat like a cancer. This disease has been around for probably 70 years. At this point, there's no known cause, no known cure, and of the 290,000 patients that come through Riley every year, they only see a handful of these diseases. And with her case, the severity of her case, they think once every 3 or 4 years is what they told us. Anyway, this disease causes protein loss, causes severe swelling. Ramonie was in and out of the hospital nonstop from probably 20 months until 3.5 with infections in her bloodstream. This disease can breed at will. She had like 13 of them in a year and a half, which were all life-threatening. Constantly battling protein spillage, body swelling, which is tons of fluid, which is all life-threatening. They treated her with some of the most, in all kinds of treatments, just trying anything they could to get this disease under control. And unfortunately, when she was 3.5, she went into complete kidney failure. At that point, she went on peritoneal dialysis, which they have to go in surgically and implant a catheter into your abdominal cavity, and then you have to be hooked to a machine which cycles your cycles nonstop for like 8 hours a day in order to do the functions of your kidneys. Ramonie was on this machine 8 hours a day, 7 days a week for 2 years.
Wow.
Yeah. At first, it was going to be a year. They were going to let her body kind of rest, try to let this disease pass, and then put her on the transplant list. Unfortunately, when they went to try to vaccinate her for hepatitis C, which is a must before you can have a transplant, she was a non-responder, so it took them over another year to get her to respond to that vaccine. So finally, after 2 years, we were able to get her on the transplant list for a kidney. Went on the list on October 1st of 2007, and praise God, on October 22nd of that same month, we got the call that they had a kidney for Ramonie through an anonymous donor that gave her the gift of life. And
wow.
Then, so on October 23rd, Ramonie underwent a successful kidney transplant. But, you think that's the end of the story. No, it's not. Her transplant surgeon came out and he told us, the kidney's working, surgery went well. But now here comes the scary part. We have to wait to see if this disease is going to come back, because she has this disease that's so rare and so crazy that 1 in 3 people will actually lose their transplanted organ to the exact same disease because it can just flare back up. And if you make it 5 days after your transplant, you're in the clear. So we start the countdown. Day 3, it's back. And not only is it back, it's back with a vengeance where it is trying to destroy that kidney and do it quickly. So Ramonie had to go back into surgery 6 days after transplant. They removed one of her old kidneys to see if that would slow the disease down. And then they also implanted catheters in her chest that lead down to your heart in order to start what's called apheresis treatments. And this is where they actually cycle the blood through a machine. You can actually see it being separated by this machine, and then they put in donated blood and try to clean her blood so they can stop the spread of this disease. This is nonstop treatment for 6 weeks, almost every single day of her having to undergo this process, which pushed her body to the absolute limit of what she could possibly endure. Because she has no immune system from the transplant. Now these treatments are just taking it to the brink. But after 6 weeks of treatment, we got the word that they had finally got this disease in remission after almost 5-year battle with it. And it was on top of that, it was on Christmas Eve that we got the word that she was in remission.
I bet you never thought you'd know so many medical terms.
People always ask my daughter, now, are you guys doctors or nurses? And we're like, no, but when you have a sick child and you're here at Riley, they keep you so informed of everything that's going on. And with Ramonie, we made her aware of everything that was going on. Whenever she could understand something, we tell her, because that made her less afraid of what she was going through. And they let her participate in a lot of her treatments, and she'd push a syringe here and help with the blood pressure there. And that just made her more comfortable with what she was going through.
Do you remember that, Ramonie? Before your procedures, do you remember the doctors talking to you, and did they tell you what they were going to do, or try to explain it to you in some way?
Use your microphone. That's your phone.
Yeah, so she getting embarrassed now. 10 minutes ago, she looked at me and she goes, hey, when are we doing this thing? Did you not? Who are your heroes, Ramonie?
My doctors and my nurses.
Why?
Because they help me get better.
Yeah, and do you feel good now?
Yes.
You look beautiful. I asked you that. Do people tell you that all the time? What'd you say?
Thank you.
She does have the beautiful smile.
She has one special hero, who's your very special hero.
Dr. Goggins.
And what did Dr. Goggins do for you?
He gave me my transplant.
That's her transplant surgeon. They have a beautiful, close relationship after the fact. So
We've developed these bonds here, and we're getting ready to kick off a big push here, because we're going to be done at 6 o'clock, and we got to get some more Miracle Makers. So we're going to get to it here in a second. But why would you tell someone to donate if they're getting ready to right now? We're going to give them all the numbers. We're going to give them all the details. It's $15 a month, 50 cents a day. But what do you think you could tell our listeners right now why they should?
Because it could mean the difference between life and death for a child. And with Ramonie, with having a disease, there's no known cause or cure. The odds are stacked against you. She had a transplant. The disease came back. And she's here today happy and healthy. And also the 2010 Children's Miracle Network state champion for the state of Indiana.
Yay!
That's what God, working through Riley Hospital with incredible doctors and nurses, can do. And so that for no other reason, we never thought that this would happen to Ramonie. No one ever thinks that this will happen to their child. But if it does, let's give them the resources so that hopefully their child will have the outcome that Ramonie has had. Happy, healthy, and looking forward to her future.
Well, we said we wanted Ramonie to kick this thing off. So, Ramonie, I want you to turn around there, and I want you to give him that phone number, and I want you to tell him to call now.
1-888-745-3954.
That's right. It's 888-745-3954.